Today we're going to talk about the sixth most common type of cancer and one of the hematologic cancers, a blood-based cancer, and it's called leukemia. Now, leukemia can be further defined as either acute leukemia or chronic leukemia. Acute leukemia happens when there is significant deformity to the blood cells very quickly and cause symptoms fast, where chronic leukemia, the dysfunction and deformity of the blood cells happens slowly and may take years before symptoms develop. That being said, someone who has chronic leukemia can suddenly then develop an acute phase of leukemia. So they could have subclinical symptoms for a long time and then quickly develop acute leukemia. Risk factors for leukemia include some kind of genetic abnormality as well as Down syndrome. So how does leukemia start? Well, we know that all blood cells start in the bone marrow. And they start as these stem cells, these non-specific cells that can morph into different things. And those stem cells can form into myeloid stem cells or lymphoid stem cells, which further differentiate into things like erythrocytes and monocytes and our B cells, T cells, and our natural killer cells. Now remember, all of these start in the bone marrow, and then many of them stay in the bone marrow to grow up, but then the T cells migrate up to the thymus gland to finish growing. And so this is how our blood cells grow in the bone marrow. But what happens with leukemia is that somewhere in this process of differentiating, the genes get mixed up and we start not being able to get these fully formed cells. So specifically, if you look at like the B cells, they're not able to fully form. And so we get all these immature kind of half-formed cells, but never the full cells that we need for our blood. And depending on which cells are the ones that are not forming correctly, that'll be the kind of leukemia. So if it's a lymphoid cell, it's going to be lymphoblastic leukemia. And if it's a myeloid stem cell that's misformed, it'll be a myeloid leukemia. Specifically, we've got four kinds. We can have acute or chronic, and we can have myelogenous or lymphoblastic. So depending on which stem cells are involved and if the onset is acute or chronic, fast or slow, will depend on the type of leukemia that is described. Now, leukemia can be the difference in types you'll see in different types of patient populations. Acute leukemia is more common in children, and the ALL is the most common type. It has a very abrupt onset and a rapid progression, and it includes less mature blast cells. And then chronic leukemia is more common in adults. CLL is the most common. It has a very subtle onset and a slow progression. And it involves more mature cells. So they are already a little bit more progressed. They didn't quite finish progressing till being fully formed cells, but they're more mature than they are in the children's cells. Signs and symptoms are going to be things like swollen lymph nodes, lots of infections, getting sick easily because they don't have a fully functioning immune system and all these, fully functioning B cells to ward off infection. You can see anemia if their red blood cells are impacted, and then bleeding as their platelets can be involved. Medical diagnosis is going to be based on lab results. And sometimes a bone marrow biopsy and some genetic testing. In our lab results, we're going to see increase in white blood cells, leukocytosis, low platelets, thrombocytopenia, and low red blood cells, hemoglobin, and hematocrit, or anemia. It'll also be based on history and physical. Sometimes a bone marrow biopsy is taken, and sometimes genetic testing is performed. Treatment for leukemia can include chemotherapy as well as bone marrow transplants to replace the poorly functioning cells in the bone marrow with healthy cells that are going to be fully functioning and grow into healthy, fully mature cells. Complications of leukemia. The most common is infection because they have a suppressed immune system. They can also have hemorrhaging because they're at risk for bleeding. Myelosuppression. Myelosuppression just means a lack of blood cells, a decrease in bone marrow activity. That means that there's less blood cells created. And then finally, bleeding. And as always, let's go through the nursing process as it relates to leukemia. Patients may present to the clinic or to an emergency department complaining of some vague symptoms, like maybe some fevers, maybe some signs of infection, fatigue, and they also can present with some anemia or some thrombocytopenia. Nursing diagnoses related to leukemia include risk for infection because they're immunosuppressed, or immunocompromised rather, risk for impaired tissue perfusion due to the anemia. They don't have those good red blood cells, hemoglobin, to be able to carry oxygen to their tissue. They're at risk for bleeding due to the thrombocytopenia, and they're at risk for compromised family coping. Remember, cancer doesn't just hit one person. It impacts all of the caregivers and the loved ones in that family, and can really be disruptive to an entire family. So think about the whole family unit as you're thinking about your cancer patients. In nursing interventions, we're going to assess, we're going to take action, and we're going to teach. We're going to assess vital signs. We're going to look for signs and symptoms of anemia and poor oxygenation and perfusion, fatigue, paleness, dizziness, shortness of breath. We're going to look for problems with clotting, with the thrombocytopenia, lack of platelets, excessive bruising, and petechiae. And we're going to be looking at their white blood cells and their CBC in general. Now, actions to take, of course, we're going to administer chemo as prescribed, but only if we are a chemo-certified nurse. We're going to institute those neutropenic precautions to prevent patients from getting infections, things like avoiding sick visitors, avoiding fresh fruits and vegetables, no live plants. We're going to possibly administer prophylactic antibiotics. Prophylactic antibiotics means they don't have an infection, but they're at risk for it, so we're going to give them antibiotics to prevent that infection from happening. And then, of course, symptom management based on what they have. If they're very anemic, they may need some oxygen, for example, because they don't have enough red blood cells and hemoglobin to carry oxygen to their cells, so we may need to put them on some oxygen. Teaching, we're going to teach about neutropenic precautions, avoiding crowds, avoiding sick people, no scooping the cat litter, don't play in the dirt, wash your hands a lot. We need to keep these patients healthy because they don't have a good immune system to fight off disease. We're going to look for those signs and symptoms of anemia, dizziness, fatigue, shortness of breath. We're going to have them watch for those signs and symptoms of thrombocytopenia, low platelets, excessive bruising, petechiae. We want to think about safety precautions because of their risk for bleeding. We're going to teach them about their diagnosis of leukemia so that they understand what's going on in their body. We're going to talk about those adverse reactions from chemo and radiation, and the possibility of sterility. So the cancer treatments themselves can cause sterility. And so if it's an adult patient, sometimes they'll harvest a female patient's eggs before starting the treatment so that they have the chance of having children in the future. But family planning should be part of the conversation because of the risk for that in the chemotherapy itself. And how do we know we did a good job, or how can we evaluate the outcomes for our leukemia patients? Well, what we hope for is remission. And remission means that the cancer cells are gone, that we're seeing healthy blood cells that are fully formed, and that they have a normal white blood cell count and normal red blood cell counts and platelets. And remission, they're considered really in remission once they've been in remission for 5 years. But we want to see those signs and symptoms of cancer gone. We want to minimize or prevent complications, especially things like anemia, infection, and bleeding. A cancer diagnosis, and leukemia specifically, can be really scary. But with the right coaching and guidance from us as nurses, the patients have an advocate and a teacher alongside them as they go through the process. That's going to wrap it up for today. Thanks for listening. I'll see you next time.